Hi, my name is Patrick Kennedy. I'm a person in long term recovery, which means for me that I've not had to use drugs or alcohol or any mood or mind altering substance since February 22nd, 2011. I want to say how honored I am to join this important panel. I want to thank D.A.R.E, Frank Pegueros, for your leadership and all of the board and staff of D.A.R.E for the work that you do. Never has it been more important than it is today. The potency of these fentanyl analogs and synthetic drugs that are finding their way into every illicit drug that's bought off the street anywhere in the world means that we have an added urgency, unlike any other time in the history of this effort, to really make prevention the keystone of our efforts. Because I obviously was finally able to get into long term recovery at the age of 42. But needless to say, most of my fellows who are struggling with addiction today, especially if they are younger versions of myself, they don't have the 9 lives that I had to finally get into long term recovery. Today, as I see it as a person in the rooms of recovery, I see people relapse and I see them die. And the fact is that we need to take a urgent approach because we know addiction is a relapsing illness. And so if one is relapsing on the kinds of potent drugs that we're seeing in the market today, the consequences are far more than we've ever seen. As horrific as they've always been, today they have a whole new dimension. I myself began using drugs and alcohol because I grew up in a family that both had the genetic predisposition as well as the environmental factors. My family suffered from great trauma in their collective lives. I also had a genetic predisposition to addiction, which had plagued family for generations. And yet, as we know, our healthcare system, our society, our culture never was about identifying people who were at risk and ensuring that we made every available option available to them to get the needed prevention they so deserved in order to not succumb to this really deadly illness of addiction, which is leading to record high level of deaths, and our mortality rates from these illnesses continue to skyrocket year over year. We are dealing with the situation where right now, as we approach addiction, we wait until it's a stage 4 illness. We rarely approach it like we do with cardiovascular disease or cancer, diabetes, when we're trying to find someone's family history, so that we know that when combined with their high cholesterol levels, they're going to be at much higher risk for a premature stroke or heart attack. We don't do the kind of inventory, family history on cancer, so that we know to take an extra eye of precaution on anything that may show up. Because what we know in healthcare and in our society, and what we always talk about doing in the House of Medicine, is getting in early and preventing these illnesses from becoming metastasizing, from becoming really persistent illnesses. And the best way to do that is to get in early, to understand the risks, and to be responsive. We have found that in our healthcare system, in my own experience, I've been taking, statins, Lipitor, and the like for 20 years. How was it that the medical system thought that it would be good for me to start on a statin early in my life because of the high risk that I have in my family for stroke and for a heart attack? That's the kind of approach we need in addiction and mental illness. And it's one that is not out there. We do wait till these become stage 4 illnesses before we intervene. We do not try to do the early screening and risk assessment and prevention that we know works in every other illness and especially works in addiction, but for the fact that we have never really put our shoulder behind it. But now, you all at D.A.R.E have led the charge. This is your legacy. This is your mantle. You have been about prevention all the way along. You've been about public health, identifying risks, understanding the consequences of drug use, initiation. This is the time for us to get the D.A.R.E message out like never before. I just want to say, when I had the honor of sponsoring the Mental Health Parity and Addiction Equity Act in Congress, it was signed in 2008 by Republican President George W. Bush, I had the honor of fighting for a bill that recognized that addiction, like all other brain illnesses, is just that, an illness of the brain, just like every other illness of the body, and that what we needed to do with these brain illnesses is we needed to treat them in the same way and get them reimbursed in the same way as the rest of physical illnesses. And so we passed a piece of legislation that required insurance companies to pay for care at the primary care level, secondary care level, tertiary care level. And we required that whether it was inpatient in-network or outpatient in-network or inpatient out-of-network or outpatient out-of-network, whether it was medication assistance or whether it was emergency room assistance, that we would reimburse for that care, just the way we reimburse for all other chronic illnesses. And I found that when we passed this law, I wanted to spend the rest of my life trying to get this law implemented, because I still saw too many of my friends, colleagues, and fellows in recovery struggling to get health care for their illnesses of the brain, for addiction and mental illness, comorbidities, because of the fact that these illnesses have never been treated on par with parity like other illnesses. I found that when I left Congress, started the Kennedy Forum, and sought really an effort to enforce the parity law through an initiative called Parity Track and Parity Registry and Don'tDenyMe.org, I really found that we were overwhelmed in the United States by the existing need for mental health and addiction services. I found that we had so invested in addiction medicine, in mental health treatment, in the capacity to deal with our nation's needs, that we were facing a crisis that was unparalleled, because the need was rising, and yet the capacity to deal with that and meet that need was so diminished from years of neglect. And then COVID happened, and we saw that need really grow exponentially, but our capacity didn't grow to meet that need. And so now we're in even more challenging times in terms of the enormity of the demand for services and the lack of services to meet that demand. I mention this in the context of our discussion about marijuana and the dangers of commercialization and legalization. For one reason, because it would seem illogical that at a time of such great need, where the burden of these illnesses of addiction are so high, where mortality is greater than it's ever been before, that we would be giving a green light for an industry that is an addiction for-profit industry, makes its money off of commercially selling to more consumers. Thereby, their profit is only justified based upon how many more people they can get to use their product. It just seems to me so insane that if we're serious about addressing our tremendous overdose crisis, that we at the same time would be introducing a new addictive industry, which is not anything but a new product. It's not what people call it, marijuana. It's a potent form of THC. It's like comparing crack to cocaine. They're two different powerful drugs, but one exponentially more so than the other. We know that it's like saying that fentanyl is the same as Oxycontin. They're two very addictive drugs, but fentanyl is of such a magnitude more powerful that to ignore those differences is to really ignore reality. And what we're seeing with marijuana, that the idea that we're comparing the new crumble, and which is 98% marijuana wax, product that you smoke like it was crack cocaine, to a joint with less than 1%, 2% THC from 30 years ago. It just does not make any sense whatsoever. And the notion that we would think that marijuana also means drinking THC laced Fanta Grapeade, that we would equate marijuana with edibles and elixirs, both food and beverages that have very high rates of THC in them. To think that those two things are the same is an equal misnomer. And that is why, for a multitude of reasons, we really need to understand that this new effort to commercialize addiction for profit is really reminiscent of the old phrase, fool me once, shame on you, fool me twice, shame on me. We have seen the legacy of when tobacco, the liquor industry, and most recently Purdue Pharma and the opioid manufacturers, when they saw the profit of addiction, they wanted nothing to do with regulations. They wanted nothing to do with the public health, because the profit was so overwhelming that it corrupted every institution around it. We saw big tobacco lie for 100 years. We've seen the real impact of advertising hard liquor, and a higher number of lobbyists for the liquor industry per member of Congress and state legislator than any other lobbying industry that we know of. And we've seen the impact from looking at what happened with Purdue Pharma to know just the corruption that accompanies this addiction for profit industry. And now, how in the world could we be repeating these same mistakes by thinking that we can commercialize a whole new product that not only is wholly different from the one that it's compared to, but is now going to be even more accessible to young people through all of these candies and gummy bears and soft drinks that have THC in them. This at the time when our young people are suffering from record amounts of anxiety and depression. And it makes you wonder, how in the world could we be putting their lives in such jeopardy when they're already trying to, deal with the traumatic impact and uncertainty of COVID. They're already dealing with having grown up on technology, which has created its own set of challenges for them socially. And now we're making marijuana, i.e. THC, more potent than you've ever seen, available to them to help mitigate in a short term their anxiety, as opposed to giving them the kind of support that they need to manage the stress that they're all living with, really at toxic levels. We are really forcing our kids to run the gauntlet. And how irresponsible is it for us as adults, as for us as leaders in society, to put our children through this gauntlet, to put pot shops on every corner, disproportionately in minority neighborhoods and communities of color, and disadvantaged and socioeconomic depressed communities where we're seeing 13 times the number of liquor stores in these neighborhoods than you would find in affluent neighborhoods. And the same is obviously going to be true with marijuana and these new THC products. It really doesn't make sense on any level. And certainly at a time when we're seeing that if people get introduced to addiction and self-medicating early in life, they're going to be at jeopardy for the disease of addiction. And if you introduce an exponentially greater number of people using these products because they're commercial products and they're more easily accessible, then there's going to be that greater number of that bigger whole that has a percentage towards predisposition towards addiction who are going to get addicted, and they are going to be at greater risk because of the potency of these fentanyl analogs and other synthetic drugs to dying from the disease of addiction, whereas a generation ago they may not have faced that impending mortality because the disease of addiction, which today is really a death sentence, given the kinds of synthetic drugs out on the street that often are mixed with the black market marijuana, which still is the predominant marijuana sold in the United States, in spite of those communities that have commercialized marijuana, because the black market still can undersell the legal market in terms of cost. They still are the dominant. So in fact, commercializing marijuana gives the false impression that using marijuana is safe. It de-risks it, which is another great lie in this whole experimentation, so to speak, on commercializing and legalizing marijuana. We unfortunately are going to have to learn again through a huge public health disaster how devastating this nation's appetite for commercialization for marijuana is going to be. And tragically, it's going to be those with a predisposition to addiction. It's going to be those with a kind of challenged background of trauma. It's going to be those with a low amount of socioeconomic value, who are marginalized in society, who are going to be put at greatest risk for to become victims of this new commercial marijuana industry. And I want to thank all of you for joining in the effort to sound the alarm. The earlier we can stop this moving train towards commercialization, the more lives that will be saved. And thank you, D.A.R.E, for leading this charge. Thank you, Smart Approaches to Marijuana, my good friend Kevin Sabet, for all you've done to sound the alarm. And look forward to the conversation to follow. Thank you very much.